Hello dear friends, how are you today? I hope you are well. Here we are going to evaluate another question of cardiology. A 74-year-old man started having chest pain. He has a blood pressure of 70 on 50 mm Hg. He is conscious and a radial pulse is felt. An ECG shows the following rhythm. What is the single most likely diagnosis? Okay, A. Supraventricular tachycardia, B. Ventricular tachycardia, C. Ventricular fibrillation, D. Atrial fibrillation, E. Atrial flutter. As we can see, this ECG is showing ventricular tachycardia. According to the sign and symptoms in the patient's ECG, we can say that the patient has ventricular tachycardia. Here we are going to explain it. Explanation. This ECG revealing a broad complex tachycardia with absence of atrial activity in a conscious person can only be ventricular tachycardia. The hypotension seen here supports this. Cardiac arrhythmias are more common in patients with ischemic heart disease as the given history. Occasionally in the exam, they may include a picture of an ECG showing a broad complex tachycardia. Again, pick ventricular tachycardia if the patient is still awake, as it is impossible to see a ventricular fibrillation in an awake patient, and this is an important point when we cannot distinguish between the ECGs which one is ventricular tachycardia or ventricular fibrillation. But if the patient is awake, we must choose ventricular tachycardia. But if the patient is unconscious, the choice can be ventricular fibrillation, as it's impossible because it's impossible to see a ventricular fibrillation in an awake patient. Okay. Ventricular tachycardia. Ventricular tachycardia may impair cardiac output with consequent hypotension, collapse, and acute cardiac failure. This is due to extreme heart rates and lack of coordinated atrial contraction or loss of atrial kick. The rate of ventricular tachycardia is from about 100 to 250 beats per minute. P waves may be present or absent. P waves are usually not seen if the rate is increased, but if present, the P waves have no relations to the QRS complexes of the ventricular tachycardia. As we can see in this ECG, it's showing a broad complex tachycardia, which is a ventricular tachycardia. We cannot see here any a clear P wave, but if we can say if this is P wave, there is no any relation between P waves and ventricular contraction or QRS complexes. Here we can see another ECG which is showing ventricular tachycardia, a broad complex tachycardia. Okay. Ventricular tachycardia can present in two ways. With pulse, we can detect the patient's pulse and hemodynamically stable or hemodynamically unstable. Example, the patient has hypotension, chest pain, cardiac failure, and decreased conscious level. And without pulse, the patient's pulse is not detectable. Management of the patients coming with ventricular tachycardia depends on how the patient presents. If the patient has pulse and is hemodynamically stable, antiarrhythmics like amiodarone, lidocaine, and procainamide is the best choice. But if the patient is hemodynamically stable, example, the patient has hypotension, chest pain, cardiac failure, and decreased conscious level, immediate electrical cardioversion is the best choice. But if the patient has no any detectable pulse, immediate electrical cardioversion is the best choice. Here was a short explanation about the patient coming with broad complex tachycardia with their diagnosis of ventricular tachycardia. Thank you for your attention.